As we approach implementing the new AAC Essentials, many people may feel overwhelmed or uncertain about how to begin or not sure how we're going to end. But I think the point is that you are well trained, you're educated, and you're capable, and you intend to do a good job. And those are the elements to really help you be successful here. And now we're looking at the new AAC Essentials. It is not a better time to be a nurse educator. We get to change the way we educate and improve it and make a difference. As we know, it is not enough for students to just know. They must be able to do. So how do we make sure that they're able to do? Simulation is an amazing methodology to do just that. You can put students into simulations and allow them to actually synthesize all the amazing things you've taught them and now actually apply them, which is harder than it seems. Oftentimes, sitting in a classroom, everyone thinks, oh, I got this. And then when we actually get into the simulation and having to pull it all together, patho, pharmacology, nutrition, patient teaching, administering medications, do an assessment, all the things we do as a nurse, it becomes a little bit more challenging. And to allow students to actually, what I think is rehearse this before they get in front of a patient is essential. So simulation is a very valuable tool. Many of you have been using simulation for years, and now you're thinking, how do I integrate the essentials into this? So what I would like to suggest is that you actually consider going back, reading the essentials. I know sometimes we get a new document and we scan it, but as I've dove deeper and deeper into the essentials and reading the competencies and the domains and competencies and then the sub-competencies, I see that I actually developed simulations targeted towards some of those sub-competencies. So now I'm going back and I'm actually mapping those competencies to the simulations, which is really important so that people can see where it is. There are things that maybe simulations can address that I haven't yet considered. And I want to create some new simulations that will actually address certain competencies and sub-competencies for our learners to embed themselves in this rehearsal of patient care so that they move towards competency. I believe that competency is essential. We want to produce competent nurses. But I do not think that we can judge that by any one methodology. Lecture, seminar, papers, simulation. We have to do knowledge, skills, and attitudes. And we have to really be able to observe this multiple times in learners and actually see them consistently be competent. So simulation is one of these ways that we can move students to that. But again, we want to really see it in practice. We recently did a simulation. We use a product that has our students do 6 or 7 patients care individually, and then they come to us for debriefing. In that debriefing, you can see that they know a lot. We've done a great job teaching them. But being able to pull it together in the care of these patients and figure out what is the most important thing to do first, and following the protocols that they've read about, but now actually doing it in the right sequence is harder. The simulation allows them to try and fail and try again, and then come to debriefing and actually learn what I did wrong and why that was wrong so that I can go back out and do it better the next round. But most importantly, that I can do it better when I'm out there with a patient. We've seen evidence of our students actually being able to do this kind of in-depth simulation and then debriefing and then immediately going out and rescuing patients because they've been able to synthesize all that they've learned and rehearse it so that when they see it in a patient, they notice it, they recognize it, they apply the expertise that they have now solidified, and they're able to rescue the patient. That's the value of simulation. It makes a difference in the student's ability to take all the many things that they've learned and now put it together in a way that makes sense for patient care. And we are producing better students through the use of simulation. Doing the same and changing the name is not going to work. We really do have to re-envision it. So we've been teaching leadership, as I know you have, for a long time. And we know that that's one of the components of our competencies that we're trying to address. In order to do this at a higher level, we have partnered with the School of Business, and we have developed a peak performance simulation. This simulation immerses our students into the day of the life of a nurse. As learners, particularly when they're novice, they begin to think that they go in and they have a patient load and they know it's going to be more than 1 or 2 patients, and there's where their focus is. But in this simulation, we run them through 6 different rounds, and we put in things that happen in the life of a nurse. So they get paged, they get called and say they need to go see a family member. They're trying to do rounds with the medical team, but actually get pulled for a staffing issue, or an emergency that's happening, or a patient who's become combative, and how do they manage that? So they're having to make judgments about what's priority, how am I going to respond, and they actually have to write out their response to how they will actually address this. So one of the examples in this simulation that we created was that the patient is ready for surgery, and someone inadvertently didn't cancel his breakfast. So he received his breakfast, which then means he cannot have surgery. So he is getting ready to go to surgery, this happens, and now it's a cascade of events in the OR because the surgery's been canceled, and so people are wanting to know what's happening. So throughout the day, this nurse gets pinged about why did patient X eat breakfast? And so they get asked that about 4 different times from 4 different people. And they begin to realize that they have to be self-aware and manage their own emotions, because they can't say, I've already told you this before, because it's a new person who's asking. And then we also are training them to be responsible for what happened, but not to be overly apologetic, but to actually say, I'm sorry that this has happened, I'm going to look into it, and we're going to figure out how we can keep this from happening in the future. But there's not anything we can do about today. So I would like to, I'm happy to talk more about it if you would like, but we are looking at this and examine it for a quality improvement perspective. And so that way we are having them rehearse a more effective way to manage the things that's going to be coming at them, and how they manage all the different nuances that occur in the day of the life of a nurse, in addition to the critical care of their patients that's happening. At the end of this simulation, they actually get time with coaches from the business school. So these coaches actually help debrief this and talk to them about their leadership and their management of conflict and the different ways that they can grow as a leader. And then they offer them one-on-one career counseling, and they can ask them anything and help them think about where do they want to go in a career. This is a phenomenally unique and innovative way to train our nurses in simulation in a way that advances, I think raises the boats, if you imagine, in the pond for leadership training. So if you're new to simulation, or you're beginning to think about how do I create a new simulation to meet the essentials, there are resources that are available for you. One of the ways that is really helpful to start is to kind of, if you imagine doing a storyboard, a kind of mapping of the simulation with the end in mind of what you want to accomplish in this simulation. And there are free resources for you that you can download and use. The California Simulation Alliance that KT Waxman is head of actually has some templates on that website that you can actually go and download, including a blank development storyboard and also one that has been filled out. So you can kind of get a feel, how do I begin this? And then after you do the storyboard, you go into a more in-depth kind of development or template, if you would, of the simulation. And this simulation template have a few examples as well. We like to call it a technical one, maybe skill development. Let's take, for example, around congestive heart failure for the entry-level student. Or you might actually have one that's more non-technical. It might be a leadership simulation that you're doing for the advanced practice nursing student. And those two have a little bit of nuance difference, but in this template, KT and I and others have actually embedded ways for you to track the QSIN competencies, the quality, safety, education for nursing competencies, the AACN essential competencies, and we've interjected certain specific competencies that are relevant to us at UNC. For example, we do our core tenets from our curriculum development. Others may do other standards like the interprofessional practice and education collaborative competencies. So you can embed your competencies, but it's really helpful in the template to have all those things there so that you can actually track them. And one of the things I love about this template is it has a place for you to upload photos into it. So when you get your simulation set up, take pictures of it so that you can replicate it yourself next year, a year later, when you're like, how do we set it up? And also, you can also show new folks who maybe are trying to adapt your simulation to their workplace to be able to do that as well. And so pictures are important because many of us are visual learners, and that's a great way to do that. So this template kind of has it A to Z for you. And again, it's a free download from the CSA, and also we'll offer it up for AACN's website as well. There are a lot of other resources I think that you should be aware of that you might not. The International Nursing Association for Clinical Simulation and Learning, INACSL, is actually an organization focused on nursing simulation. And I am a past president of that organization, and they have developed healthcare standards of simulation best practices, and they are a free download from the inaxl.org website. The Society for Simulation is also another organization, and KT Waxman was actually a past president. So, and she, there is a code of ethics for simulation from there, and I think that that's really important. One of the things that we talked about is in simulation all the time is creating a safe place, a place that students can try their best and maybe sometimes miss the mark, but not to be shamed or blamed for that. And that because we want them to learn, and that's what this is about. So we have to create a psychologically safe place for learners. And we also want to make it a brave place, a place that students can share courageously the concerns that they have, the struggles that they're having, and get some help from peers as well as facilitators to how do I navigate this and be able to do that. One of the things I talk about a lot with my learners at UNC is that I am coming along beside them, not above them or below them, along beside them to help them become the nurse that they dream about being. Because they have come to our School of Nursing to become the nurse that they in their mind imagine that they will be, to make a difference in people's lives every day. And we are obligated and privileged to provide them with the education that allows them to become that nurse. And we do a great job at that at UNC. It's an exciting place to work, and we have great students. And it's really important that we optimize that time with them to help them to realize their dream. The AACN has done an excellent job pulling together a lot of resources from a variety of experts around the nation, and those are available to you on the website. So it is a living document so that you continually need to go back and see what else is new there for you to adapt to. And also it gives you a chance to consider new ways of doing what you want to accomplish. There are templates there are webinars, there's tools that you can download and use. And so always go back to AACN and look and see what else is there. In the simulation work, we will upload some of the templates that we offer for that, so they'll be readily available to you as well. But resources are important. We don't need to recreate the wheel. Let's build on each other's work. Let's grow what we have and then come back and share that again so that others can use it, and that we continue to grow and really advance nursing education across the nation from one school to the next. So because the goal, again, is really thinking about the outcome. How do we prepare the best possible nurse to provide quality and safe care to everybody that they care for.